Assalamu alaikum. Hello everyone, and thank you very much for giving me this chance to present my lecture in the Iraqi division of IADR in Ankara, and hope you will enjoy this lecture. Our topic today is the management of root caries using different fluoride varnish formulas in dry mouth patients. Root caries is a significant growing dental problem in the 21st century, and this could be related to the increasing in the aging population that expected to reach 2 billion in 2050, and also an increasing in the number of people who are trying to keep their natural teeth with a full masticatory function for a longer time. With aging, there is a more chance to see these teeth with an exposed root surfaces, which make them more susceptible to be attacked by bacterial and acids and initiate root caries. To manage these decays, using a conventional approach, a drill and fill procedure, there is a high risk of failure, and none of the material could stand long. In terms of minimally invasive approach, there is a high evidence to recommend fluoride rather than non-fluoridated agents, and the most recommended treatment to date is the 5,000 part per million fluoride. However, the immunization process could be enhanced by providing calcium and phosphate in addition to fluoride, since the immunization process and the formation of fluoroapatite crystals requires these three elements. And this could be of a clinical value, especially in patients having dry mouth, since they are usually have no saliva or very little amount of saliva in their mouth, which is considered the main source of calcium and phosphate. Therefore, the aim of the study was to assess two different varnish formulas, either with calcium phosphobutade amorphous calcium phosphate, which is a source of calcium and phosphate, and fluoride, or fluoride alone treatments in patients with dry mouth. Initially, we did an experimental study to assess the ionic release of three different varnish formula, and we found that the ionic release for the CPP-ACP varnish, which is the calcium phosphobutade amorphous calcium phosphate, had much fluoride ion release compared to the Bioglass one, which is considered also a source of calcium and phosphate in addition to fluoride, whilst the fluoride alone treatment had the lowest fluoride release. And this could be of clinical value while we are looking for a short period of release, or such as amide varnish, or a longer period of fluoride release. And for the calcium and phosphate ion release, we found that also the amide varnish had much higher ionic release, thus mean much higher calcium and phosphate compared to the Bioglass one. So to conclude, both CPP-ACP varnish and Bioglass varnish had the ability to release calcium and phosphate in addition to fluoride, and this is the active ingredients of these varnishes. Turning now to the clinical study, and we approached more than 800 subjects to recruit 80 patients with root caries and dry mouth, and those were stratified according to the age, and they are randomly divided to receive one of the following treatment, either with calcium phosphobutade amorphous calcium phosphate or fluoride, and we excluded the Bioglass one because this treatment not yet been approved for clinical use, and each patient had to attend 3 visits to complete the study, and in each visit we did plaque index assessment, saliva test, root caries, clinical criteria, and diagonodont as well, and we provide oral hygiene instructions and standardized tooth paste during the study, and finally we applied the dental varnish. In the result, we found that there was no significant difference between the two groups with regards to the flow rate, saliva pH, and buffering capacity. And this is a confirmation that those patients were dry mouth during the study. And also we found that there was a significant decrease in the plaque index during the study, and there was a significant difference between the two groups just at the baseline. And for the severity index, which is the primary outcome, there was a significant decrease in the severity index during the study, and the CPP-ACP varnish had much higher change or improvement after 3 months compared to the fluoride ion treatments, and there was a shift from leathery to hard texture around 64% compared to the 43% after 3 months. However, at the 6 month, the CPP-ACP varnish still had higher change toward the hard texture, but not significantly compared to the fluoride ion treatments. And we found that the non-cavitated lesion performed much higher change toward changing from leathery to hard texture compared to the cavitated lesion, and this is after 3 and 6 month time points. And also there was a decrease in the surface roughness in both groups. However, the CPP-ACP varnish had much higher change toward smooth surfaces, and this result was consistent with the severity index results. In terms of lesion dimension, there was a significant decrease in lesion dimension during the study, and this is on both groups. Sorry. And also there was a significant increase in the lesion distance from the nearest gingival margin, and this was on both groups, and there was no significant difference between the two groups. And also we quantified the lesion activity using the diagonal depth, which measured the bacterial byproducts, and we found that there was a significant decrease in the lesion activities in both groups, and there was no significant difference between the two groups during the study. We did also a regression analysis, and we included the plaque index as a covariant, and also we found that there was no significant difference between the two groups with regard to the severity index. In conclusion, fluoride dental varnish, either with or without calcium and phosphate, has the potential to reverse or arrest root caries in dry mouth patients. As a summary, application of dental varnish either with or without calcium and phosphate at a 3 to 6 month interval has the potential to reverse or arrest root caries in dry mouth patients. Also, it's beneficial to detect and manage root caries at an early stage, because as we found that the non-cavitated lesions were more likely to change from leathery to hard lesion. Thank you very much for your listening, and hope you enjoy this lecture. And this is my supervisor, Dr. Alan Baysan, and Dr. Anwar Tapouni. They are very supportive, and I recommend for anyone who would like to study at Queen Mary University of London. And this is the day of my celebration with my PhD 5. Thank you very much.